Dr. Moshmi would be speaking. If you are a woman ophthalmologist, what are the challenges? But due to some other issues, we are changing the orders, and Dr. Tejas will be presenting first. If your children are non-ophthalmologists or non-medicals, a big problem.
Um, Thank you, Dr. Rajan. Well, very sorry, but they have put me in as a judge in another session, and that's the reason I'm trying to rush. And it was my bad that I did not see the times properly. I thought this was not overlapping. So, well, beyond 60 and no kids as an ophthalmologist, that was a topic given to me. First of all, let me tell you, I'm not 60. Okay, so don't overestimate me. I'm not yet 60. Well, now any planning you would have already understood when you are 50 or 55 that your children are not going to be an ophthalmologist, correct? It is not that at 59 years and 362 days that you know that your kid is not an ophthalmologist. So your planning has to start probably around 50 or 55 when you already know that your kids are not. Well, I have two daughters. One is in USA married, and my second one, she is given a plab and she is going for a psychiatry. My wife is a dermatologist. Can you see silk skin? We have a very huge practice. We have our own building, but my daughter doesn't want to join us, so we cannot force her, right? So planning, planning, and planning. That is the most important thing that you should be doing. Now, what kind of a planning that we should be doing? It should be in three different groups. One is financial. The most important is financial planning, because if you have money, your physical and mental health is definitely going to be better, but not vice versa. You might have good physical health or mental health, but no money. Well, that also is not a good idea. So to me, financial planning and independence is the first, then a physical planning, then a mental independence. And frankly, at this point of time, your planning should be such that your life is beyond money, right? And what is there beyond money? Well, you want to be happy, correct? Everybody wants to be happy, and especially more so because you have more time after 60. And so beyond money, what you have to think about is happiness. Now, let's see some different scenarios for each one of us. For example, I'm in a private practice, but for me an advantage is that I'm in a group practice. So my thought process will be different. What would be an ideal condition, which is what I think about myself, that I should drop dead in my clinic और वहीं से ले जाओ मेरे को. That would be the most ideal condition, but well, that might not actually happen. So what are the options that you have? Well, you can gradually close and dispose of your things and then think of something else or join another place. You can sell your practice and be an employee, right? A lot of chains are now taking over your practice, and you can choose this, but this is going to be very, very difficult once you are above 50-55 and you had a roaring practice and you are your own king. So sell and be an employee. I'm actually not actually pursuing that idea, even though a lot of offers come to me. Well, I might wilt under pressure. To me, the most important thing is pass on the baton, right? We have worked so hard to create a small, whatever kingdom that you may say, a very small one, right? 1 CR, 2 CR, 5 CR, 20 CR. But that is your baby. Understood? Right? It is your baby. So what should we think? And what is my group thinking at the moment? We want to give it back to the society. And what better than giving it to our youngsters? So we are actively pursuing since last 2 years to rope in youngsters. And our advertisement says that Ahmedabad Eye Laser Hospital wants a partner, not an employee. We want a partner. You join us. We don't want any investment from you. We have already invested. We are flush with money, but you have to give your commitment. So the commitment is that you work with us for 5, 10 and forever. Once you join our organization, you cannot leave the organization. You cannot practice in the city of Ahmedabad. That is the only condition that we have for them. And we don't want any money from you. In fact, as the number of years pass, you will start getting a percentage. Ours is a private limited company, so we'll start getting percentage. And that is how we have planned to go ahead and give our pass on the baton. But these decisions are also based on a lot of other variables, like whether your spouse is an ophthalmologist or not, whether the spouse is a doctor or not, whether the spouse earning is more than yours. Well, because I'm talking about both the genders. So it might be a case that the spouse might be earning more than you. Well, in that case, it is very easy because you are shutting down something which was not the primary income. Understood? This was a secondary income. So when you have a primary income and when you're shutting down, it is very important that a planning has to be done. I'm just going to play a small video clip about money.
We are so close to all being together. We can sense it. Heartbeats come out of our chest. We taste true friendship again. A scent that says, I love you. And hugs and kisses from childhood friends. Getting closer and closer together. Priceless. MasterCard is creating priceless surprises every day by giving away reunion trips. Learn more about the vaccines and start something priceless.
Agreed? We have to create memories which are priceless. And probably these memories will allow you to live a more respectable life, but ultimately you need money, right? And a good planning only will allow you to actually live very happily even after 60. I would say with a kid as an ophthalmologist or without also. Warren Buffett very rightly said, if you don't find a way to make money while you sleep, you will work until you die. And this is not what we want, right? Sensex is high, gold is very costly, properties are not affordable, and banks are not reliable. Well, this is a time when a lot of banks were also going down. So relationships, feelings and friendships, this is what we should have when we are beyond 60. Well, your relatives might desert you, but your friends are never going to desert you. And I always say, and colleagues, sorry, I would also say colleagues, especially if you are well traveled, like, you know, in my CV, my hobby is traveling and making money. Well, these are my, but the bottom line is traveling, making friends and making money. And beyond 60 or even before that, you should start helping others, because that satisfaction is even more than money. The satisfaction of having help. And that is the reason we do not want to sell our hospital to one of the chains. We want it to be given to some few youngsters. And that is how we want to help others. Well, you have to think about all these things also beyond 60. You have to be happy. You have to do all these activities beyond 60. But for all these things, what do you need? Money. Well, you can have your vacation at this age and at this age, both ages, correct? Well, you choose whether you want one or whether you want both. Zindagi na milegi dobara. Sir, 60 or not 60, understand, we have to live our life. And I will end with a very nice quote. Well, this is my life. Well, that is, we are, you know, Ahmedabad is known for three things. This is Uttarayan, the kite flying, right? That is me and my wife. This is Garba, the Navratri. That's my daughter also with us. And well, this is our 31st December dance party. So these three things are always, we are the host for all these three things. Well, so what happens is, I'm investing in relationships, in friends and colleagues. And that is what is going to help you when you go beyond 60, whether you have a kid as an ophthalmologist or you do not have a kid as an ophthalmologist. This lovely, my daughter of mine, she's given her pleb and she's going to pursue psychiatry in UK. We are awaiting her results. I was in Kolkata last month for her pleb exams. Well, these are our friends. These are 20 people with whom we have breakfast every day in the morning in the club in Ahmedabad, if I am in Ahmedabad. Right now they gave me a call, when are you coming back? Right? So this is all we need when we go beyond 60. Not that we need it only after 60, we have been doing it since now 20 years. So yes, we also, I believe you all know that SSTC was my brainchild. Well, and now it has taken over everywhere as a training. But so this is also our way of, if you cannot actually perform a surgery, teach, right? And money. This is something which is unbelievable. Please listen to this.
It's amazing how money can be known by so many different ways. In a temple, church, or charity, it's called a donation. In a school, it's called a fee. In a marriage, dowry. And in a divorce, alimony. When you owe money to someone, it's called a debt. When you pay it to the government, it's called a tax. In a court, it's a fine. When you receive it regularly after retirement, it's called a pension. When an employer gives it to a worker, it's called a salary. When a master gives it to a servant, it's called a wage. When children receive it, it's an allowance. And when you borrow it from a bank, it's called a loan. When you offer it after a good service, it's called a tip. When paid to a kidnapper, it's called a ransom. When illegally received in the name of a service, it's called a bribe. And when used to share and to serve others, it's called happiness. There's nothing wrong in possessing money. The problem is when money possesses you. Earn more money, fulfill your needs, utilize your money to share and serve others, and transform the value of your money from currency to happiness. Thank you.
And so I end with my presentation here. What is happiness and what is life after 60? Well, you should be able to do something that you want to do, but you should have time and money to do. Well, more important is you should be able to do, correct? And for this you need financial, you need physical, and you need mental happiness, and only a good planning from 50 or 45 or 40 will help you do this. Forget about the kid as an ophthalmologist, right? Thank you. Sorry, I have to rush.
Thank you, Dr.
To another
Tejesh.
session.
That was wonderful. And we wish we had a club like you.
You can create one, sir.
The first presentation. So,
खाली खाली फोटो, नाम चेंज कर लीजिए. Thank you.
So, just like our conference, we start the sessions a day before and have the inauguration in the second day evening. So, after Dr. Tejesh, I'll be presenting the introduction of the session. I have no financial interest in this presentation, although it deals with finances, practice, and financial security. I got this idea of the heading by this movie by Bharat Shah called Club 60. All these people you see here, all good actors, they were all happy-go-lucky persons in this picture, but everyone had a personal problem, a personal tragedy behind them. वो सबको भूल के इस एज में they were enjoying like children. So how old do you feel at 60? Old? कहते हैं age is just a number. You age if you think so. Remain young in mind and heart, but don't defy your age. Your body is aging. Mentally आप कितने भी fit हैं, आपका body age कर रहा है. Live your passion. Work hard if that is your passion. Stay with younger people. Eat healthy and stay healthy. And this is the group that I spend my mornings with, young children. Some activities to remain young and fit. But what you choose after 60 depends on what you're doing. These are person specific, आपका present working, your unachieved passions, your financial security, your family needs. Do you have an urge to grow further even at this age? Do you have health issues? Do you now still love working, or is it a boring thing for you? What is your next generation doing? And what life expectancy do you expect? Priorities change with age. So the red lines, the red bars show the priority at a younger age, and the purple ones show when you are around 60. So if you see a professional success in the younger age, it is much higher than when you grow old. Same with money. Your desire to earn money is much more when you are young and much less when you grow old. Health becomes more important than when you were young. And now family is more important for you. You have to give more time to the family. You want to give more time to the family. Because younger age mein you did not have time to give it to your family. But there are people at this age, unka passion yahi hai. Continue working and expanding. He is not unknown to us. Even him, at this age, they are not stopping working, they are still expanding. But on the other end, you have people like him. Few hours of practice, club life, passion, photography, music, everything. So you can enjoy your passion and work less, travel, do whatever you like, farming, gardening. What you choose after 60 depends on what you are doing today. Options are plenty and also depends on your present working scene and the financial security. So Dr. Tejas has already presented. The next topic was Dr. Poddar's, if you are in a job. Dr. Maushmi, do you want to present right now? Okay. So Dr. Maushmi would like to present her topic first. This is some different topic apart from what you are doing right now. It is about women. Abhi women in ophthalmology ka काफ़ी importance है. Someone was telling me in this conference about 45% attendance is of women. Yes. And in a few years, reverse हो जाएगा. So their role is important. And what problems do they have and what future do they see after 60? Over to you, Dr. Maushmi. Dr. Maushmi Banerjee ka. He will say which podium. He will say which podium.
Good afternoon, everybody. Thank you, Dr. Rajan Anand, Chief Instructor, who has given me this opportunity to say something on women ophthalmology after the age of 60 years. So these are the women pioneers in ophthalmology, and my slide will be incomplete if I do not mention these women who paved the way for all of us to take up this profession. And these are the women ophthalmologists, Indian women ophthalmologists. Now, I am also 61 years old and I am in government job. My age of retirement is 65. So, there is a little chance of taking early retirement or voluntary retirement earlier. So, I will have to continue it up to 65 years. And after that, there are so many options for us. So at the age of 60, we have some privileges and also we have some challenges also. Let me say the privileges. We can continue doing surgeries as an experienced and established surgeon. We can join teaching institute and invest in academics. We can afford free time for travel and leisurely activities, but less stress at work now. Now we can have the relative freedom to choose working hours. We can invest in and opening our own clinic. We can practice as a medical ophthalmologist also if we cannot do surgeries due to the various reasons, and we can open a YouTube channel now. So eye surgeries being the microscopic surgeries and relatively short procedures for most part does not take a huge toll on our body. All these years of invaluable experience and vast treasure trove of knowledge ensures that we can manage any tricky and untoward situation or disease with utmost ease. And if in any untoward situation, unfortunate event of being unable to do or unwilling to perform surgeries later in the life, we have always the option to perform exclusively as a clinical ophthalmologist. It's a privilege when compared to the other surgical specialties. Does not take away the priceless joy of diagnosing and treating patients for a vast majority of the disease that do not generally require surgical management at all. The joy of teaching. So if teaching gives immense joy, we can join a teaching institute and teach the budding ophthalmologists, both academics and practical part of this branch, creates legacy of own and attain the respect of the fellow ophthalmologists and doctors. We can enjoy travel and leisurely activities also. Already Rajan has told, the personal practice and working hours can be adjusted to make time for investing time in probable long lost hobbies. These can include travel, photography, music, and anything that makes life worth of enjoying to us. If someone is comfortable with it, she can even take voluntary early retirement and invest full time in things like traveling to various countries and enroll in extracurricular skill courses. They open a YouTube channel. It's a very good option in the modern internet age, especially after the COVID period. Advantage of recording from the comfort of one's home, minimum investment in the setup equipment, can be educational based video channel for the medical student, can be an informative video in simple language for the common people also about the common disease and the procedures, and also we can use it for the awareness program also, like glaucoma or age related macular degeneration, what are the symptoms, when to come to a doctor for consultation. It can be used as a promotional platform for one's own clinic also. Next, we can invest to open our own clinic, but this is only when I have much capital and also the next generation is ophthalmologist. Relative freedom for doing work. Being a senior ophthalmologist, generally we have the privilege of relative freedom of choosing working hours. Now we have more time for our family, which have been neglected lot of over years in the process of honing our skills and excelling in career. In all probability, there will be much less exposure to workplace stress, which was the norm in our early career. So these are the options after the age of 60, but we also have some challenges now. The low representation in the leadership position, the breaks in the career, it hampers the surgical skill, low proportion of the women editor, long working hours can be physically debilitating, disrespectful behavior at the workplace sometimes, physical challenges of microscopic surgery for long hours. So in conclusion, I want to say we cannot change what we are not aware of, and once we are aware, we cannot help but change. Thank you.
Thank you, Dr. Maushmi. Why were you so nervous and afraid? Such a beautiful talk. I welcome Dr. I now welcome Dr. Ajit Poddar, and he will be speaking on the probabilities and options you have if you are in a job. It may be a government job or it may be a private job. For example, he is in a private job in a NGO hospital as the medical director, one of the senior most posts. Dr. Maushmi has just become the principal of a medical college. Dr. Sudhir is in a medical college. I am a private practitioner. Dr. Subhash is a private practitioner with a family of doctors, and Dr. Tejas I just told you about him. So all of them at their places are at their peak in different kind of work area.
Good afternoon, everyone. And at the outset, I'm extremely thankful to Dr. Rajan Anand sir for giving the opportunity. And I am 53. And when Rajan sir offered me, कि you speak about the Club 60, the road ahead, actually I had never planned my life and career very well. So the first time I became scary. So the most of the talks may not be with our own experience. It may look like a theoretical, but there is a lot to learn from it. So the first thing is that there is no such thing like a one life and one career. At the age of 60, the second career starts, and this career has a lot of happiness and a lot of happening with a lot of time in your hand and a lot of money also. So you may have a second career now. So being in the job, it's the most difficult thing. Being in job is like selling your soul to the nasty corporation. And society has its own bias towards the self-employment, or your entrepreneurship has a more glorified than being in the job. But not everyone has the capacity and connection and access to the resources or the drive to become an entrepreneur. So its job is perfectly okay. And being in the job is, how do you position yourself? At career at 60, you should ask so many questions, and the previous speakers have already spoken. But recently I met, he was a researcher in the organ donation, Dr. Satyavrat Sharma, 2 days before. He was 74 years old. He told me the two things, the money and health, that is a detrimental for the decision regarding retirement. So the first thing is that at this age, beyond 50, you should start thinking about the retirement, and this is a time to reboot your current practice. Whatever you are doing, how can you strengthen it, reinvent yourself, and rewire your life for the next 2 to 3 decades that you will live. Aging is inevitable, feeling old is not. And there is a fourth R, that after 60 you rediscover your passion, what you could have not done because of so many things, so many liabilities, so many things for the earning money. So in job, what are the benefits? Definitely there is a guaranteed income. There are so many employees benefits in the government job. There is a career opportunity. There are a lot of that training available in the job. And you have a less liability. You have not invested a lot in your practice. So you have time to plan for retirement. And there is a study that the millennial doctors prefer employment over the private practice. This is a Medscape survey. But definitely there is a limitation in the job, the insecurity, the exploitation, the value compromises, the conflict with the employer or the co-workers. You have a lack of freedom, the authority, and there is a burnout. So there are a lot of uncertainty. I used to think, if there is so many uncertainty, then why should we plan? Because there are so many uncertainty, then you should plan. So if you are in a job, the best thing is to capitalize on your existing skills and network. Keep your skills sharpened and make the most of every opportunity and resources. You may not have, if you will have your own practice later on and wherever you want, you may not have all those equipments, all those library, the rich library, the auditorium, everything, the training facility, you may not have, the simulators. So use that. And this is the best time to invest in your skill sharpening, training. And investing in the training is the best invest. And invest in your health also. So once you plan to transit, you should have a clear-cut plan. You should have a clear-cut reason. Why do you want to leave the job? Whether you want to retire, or you want to resign, or you fear layoff, or you fear some kind of thing that something is going on, some messy you perceive. So quit with a purpose. And you should have a viable plan. And always avoid a bitter breakup. COVID has taught us a lot. The employee stress levels are all-time high as per the 2020 search. If you are in a doubt, take a sabbatical to test the water. What will be life after you leave the job? So the most important thing is the financial planning, So start early, and if you have not started to invest, it's never too late. Saving is also a kind of income. So save more, spend less, diversify your fund. Financial things has already been. You must have an emergency fund for any mishappening, because you never know what will happen. And there be a source of passive income, because whatever we earn, we invest our time and skill. But there should be a source of passive income where you don't invest your time, but money should come up. And retire debt free. There are various phases of retirement. And another important thing that Dr. Tejas talked about the non-fiscal, non-financial. You invest in your friends, you invest in your family, you invest in your relatives. And because when you leave the job, only your boss changes. One which have hired you and the other who married you. So there is a trend in the UK, become a financially independent and retire early. So when if you are a financially independent, you can retire early. And there was a study in the UK that if you retire early, you will live longer. And definitely you can delay your retirement. And it's not the age of the employee, but how much value the individual is able to add to the organization, that matters. And the best thing is you transition into the retirement gradually. You can choose, if ophthalmology is your passion and if you feel valued, if you don't have any interest other than ophthalmology, then you can reduce your work. Because at certain age, the cognitive level, the reflex decreases. So you can choose to teach, you can choose the mentorship things, you can become a part-time, you can reduce the working hours, you can reduce the complicated surgery. You can choose to become a professor emeritus if you are in a government job, or you can volunteer for a social service. But if your ophthalmology is not your passion, then you can go into the admin or a management or leadership role. So it's all about how do you repurpose your career, how do you realign your career, and you can have a clinical career alternatives that we talked about, or you can have a non-clinical career alternatives. Like you can choose to be whatever sir told, the gardening, you can do the gardening, you can do anything that you like, some go for the photography, some do the whatever. And you can choose to work at the same place that you were working, or you can choose another workplace. So if you choose to remain in the same profession, and most of the ophthalmologists, they don't have a other passion besides ophthalmology. The doctors usually are very, very, very die-hard and dedicated to their own profession. So if you need to choose the existing setup, then you need to downskill your ambitions. You will have to, so be realistic, because you can't, at this age, if you are not performing, you can't have the same skill of the employer may not provide the same thing that they used to provide while you are performing. And it always happens. Today you are a star performer and you don't know when you will come under the chopper. Because today you like your job, but after 5 years nobody knows what will happen. And if you need to start your own setup, then you should learn to how will you compete with the next gen ophthalmologists, the cutting edge competition. Because the older generation of the ophthalmologists, they have a different kind of practice. And today there are a lot of marketing, the digital marketing, the social marketing, and we may not be so good at that. These are the two ophthalmologists. The first one, Dr. Howard Saj, he was an acclaimed vitreoretinal surgeon in US. And he changed the profession and he became a photographer, and he has published 20 books on the photography. And everyone must have been aware of the Dr. G. Venkataswamy. He retired at the age of 59 from Madurai Medical College. He was in the army, then Madurai Medical College. And he founded the largest eye care system, Arvind Eye Care System, at the age of 59 years old. This is a book written by the ophthalmologist, retired right. And in these books, there are 8 commandments: an ability to plan ahead, a positive attitude, an acceptance of change, the support network, a sense of purpose, a healthy lifestyle, and enjoyable leisure activity, and some kind of spirituality. Have faith in God. So growing old is a blessing. Planning for change, dealing with the change, challenges of slowing down, and acceptance of the change. The happiest people don't have the best of everything. They just make the best of everything. Live simply, love generously, care deeply, and speak kindly. Thank you.
Thank you, Ajit. You are much wise even before 60. So you will have a happy post-60 life.
Thank you, sir.
I now invite Dr. Sudhir Kumar. He is in a medical college as well as in a group practice, and he'll be talking on what if you're in a group practice, and then after a certain age, what's going to happen to you and what options you
दूसरा
have.
वाला दी एक Thank you, Rajan, for giving me this opportunity. I am just listening words like passion, follow your passion. Seems very nice. And really, one should think of that only. But in reality, we have passion for something during childhood. With age, we grow up, liabilities come, and you wait for this passion to be fulfilled after your liabilities are less or no. In the difference between European society and our society is that an Indian father or mother has to live with that liability till his death or near death, because here there is no social security. No social security. If your child are not so well in studies, he is going to be a burden on you. If your daughter is there, then some other burden is also there. So in reality, we are always with more burden than our counterpart in West. So we have to think a little different types, in a different mode. So we have to work till late, and by that time, our passion gets killed. And we are now sufferer, and with this, we become addicted to work, and we become workaholics, and at the same time we become exhausted also. तो रिटायरमेंट सुनने में बड़ा अच्छा लगता है, तो प्लान करते हैं बहुत सारा लोग, जैसे सब लोग करते हैं कि कब करना है. ये एक नया जनरेशन को क्या है कि अर्ली रिटायरमेंट का मतलब 45-50 के पास बोलना चाहेगा कि रिटायर हो जाओ, लेकिन ये उसको पता नहीं कि इसके बाद वो करने क्या वाला है, तो क्या क्या प्रॉब्लम हो सकता है. कभी आपने सोचा है रिटायरमेंट से, अर्ली रिटायरमेंट से? कहीं ऐसा तो नहीं यू आर टैपिंग योर नेस्ट एग अर्ली, दैट कैन बी कॉस्टली, एंड यू नो दैट यू विल बी स्पेंडिंग मोर मनी in later life than you think. So plan properly, and you can, here the expenses don't retire. Even if you retire, your expenses will not retire. And कुछ एक नया समस्या हमारे यहाँ तो उतना नहीं होगा, लेकिन क्योंकि हमारे यहाँ सोशल सिक्योरिटी भले ना हो, लेकिन सामाजिक ताना वाना जरूर है. फ्रेंड्स है, रिलेटिव्स है, जो हम लोग के यहाँ आना जाना लगा रहता है. उन लोगों क्या कि मियाँ बीबी है, एक रिटायर हो गया, दूसरा का माथा फोड़ा फोड़ी करेगा दिन भर. So this could be tough on some couples also, and सच में there is lot of time to kill, नहीं तो वो आपको kill कर देगा. So you may have a long life ahead of you. So before you plan for retirement, try to think about all these things. And as Dr. Tejas and all said that you should be having more money, because in the working life we do work, earn money, and in lieu of that money we can earn leisure time, and then you follow your passion. So this chaos in minds keeps continuing. So when you are in private practice or in a group practice, as an entrepreneurs, we have developed in wonderful surgeon and skillful people, and our lives were, we were managing good business and had a reputable and honorable name. अब ये चीज़ तो आपने प्राप्त कर लिया, डेली व्हाट्सएप पर न्यूज आता है मोटिवेशनल के, करना ही पड़ता है कि मेरे अलावा कौन है, तू मैं नहीं तो कौन बे, इस तरह से हम लोग बात करते ही रहते हैं। लेकिन इसके चलते क्या होता है कि हम लोग अपने अलावा दूसरे पर कम फेथ करते हैं। अब ऐसा लगता है कि मेरे जितना सर्जरी वो नहीं कर पाएगा, लाओ मैं ही कर देता हूँ, मेरे जैसा वो मैनेज नहीं कर पाएगा इस चीज़ को, मैं खुद कर लेता हूँ। यानी अभी भी आप शैकल्स में आ जाते हैं। यू डेवलप योर माइंडसेट दैट यू आर द बेस्ट एंड यू कीप कंटिन्यूइंग विद दैट, एंड दिस इज द मेन रीजन वेयर you have to get decoupled from this thought, then only you can get free time or leisure time. It's not only the time, you have to decycle also, because you are now 60 and you have to surrender your business. Before, it's not only the business, it's your mind which is there. आपको ऐसा लगता है कि जैसे ही हम उसको सरेंडर करेंगे मेरा पूरा बिजनेस डूब जाएगा। तो ये चीज़ कैसे सरेंडर कर सकते हैं? तो you will have to, you can hire a manager who are more professional, and उस पर आपको ट्रस्ट करना ज़रूरी है कि वो आपसे अच्छा जानता है और वो अच्छा कर सकता है। आपको तभी आप डे टू डे प्रैक्टिस से जब तक इससे अलग नहीं होंगे मेंटली, हमेशा आपको लगेगा कि वो ज़्यादा अच्छा नहीं कर रहा जितना हम अच्छा कर रहे थे। तो ये हम लोग के जनरेशन के साथ ये प्रॉब्लम है, और ज़्यादातर सोलो प्रैक्टिशनर्स इसी प्रॉब्लम में कि हम जो कर रहे हैं अपने लिए बेस्ट कर रहे हैं, और दूसरा हो जाता है कि हम अपना प्रॉफिट क्यों शेयर करें, तो इसलिए वो पार्टनरशिप में भी नहीं आ पाता है। हम लोग के साथ दिक्कत क्या है कि पार्टनर्स आ गया, सोलो प्रैक्टिस तो चलो एक बार मन में अगर आ गया तो लेकर के सब त्याग करके झोला लेकर के हरिद्वार जा सकता है। लेकिन व्हेन पीपल इज इन पार्टनरशिप बिजनेस, ही कैन बी विद पार्टनर विद वन पर्सन, मेनी पर्सन, or with a company. So that time it becomes a little difficult to shed your work and to get leisure time. So either you can sell your shares to your partner. People are doing that. They have collaborated with many corporate hospitals, and they sold their practice, got money in lieu of that, and reinvested some of that money in that company, and now they are free from doing work, or they are doing less work. This is one of the good example to sell your shares to your partner, or complete. For solo practitioner, you can liquidate or sell all your clinic to some new doctor who will be benefited by your patient in footfall, as well as your invested instruments, etc. Or you can get lease your setup to some other practitioner and get a rent from that, which will be continuing. Trust is another way of looking at selling your business, but this is not very practical in my sense. So problem with why we don't hire a manager, good manager, because we are always think that I am the best, and feeling of surrendering our own sovereignty to some MD or CFO, it's very difficult to think about, because we are not coming from company type of background or business background. So, and this is the most challenging change one has to do before you plan for taking a leave, because यहीं पर जो है mindset जो है वो change कर, जैसे ही आप दूसरे पर विश्वास करोगे कि ये हम कर सकते हैं, दूसरे को दे सकते हैं और उतना ही अच्छा करेगा वो, या जैसा भी करेगा, तभी आप इससे रिटायरमेंट, रियल में रिटायरमेंट मिलने वाला है। और ये और भी अच्छा तरीका है कि अपना अब हम जा रहे हैं, नाउ आई एम सेलिंग माई बिजनेस टू योर पार्टनर इफ ही इज एग्रीइंग, or you can sell it to some corporate people. There are many corporate here who are always looking for such type of deals, and कभी कभी मजबूरी में भी you have to sell. Sell का एक फ़ायदा होता है कि sell and forget. This gives you a good thing कि चलो अब बात ख़त्म हो गई. तो reason for sell is again a retirement, or unfortunately partnership dispute, or illness or death of your partner, and many times you become overworked, and boredom doing the same things. So all these you can go for a sale and forget, or you can go for lease and rent. This is a win-win situation for both, because other partner, the person who is coming to you, he will get a full-fledged setup, and you will be getting continuous economic support from that. Trust is basically cheating morality. It's just a way of cheating government also. So here it's not very popular. So you can always make an NGO trust, in which you will be doing everything, managing day to day, not day to day, but you will be supervising those things, and at the same time you will be doing benefit to the society and weakest of the weak people. And with this I say thank you.
Thank you, Dr. Sudhir. Dr. Ajit was listening very carefully when you were talking about the trust or mistrust. I now call the last speaker, Dr. Subhash Prasad. He will be speaking on if your children are ophthalmologists or medicos, and his daughter and daughter-in-law are ophthalmologists. Whether they join his practice or not is his biggest problem.
Good afternoon, and thank you, Dr. Rajanji, for including me in this IC, and thanks to the audience for sparing time in last session of the last day of the annual conference. So we all are growing. Many of us have come to the age of 60 years or more than that, where we are at the crossroad, where after having established some clinic or having established some hospital, now we have certain situations like our child, some of us who have married early, their child has grown up to the extent that they have completed MS, or some of them are in the medical college. But those who have actually, nowadays people are marrying very late, so for those it may again be more challenging. So I have a situation where my daughter is an ophthalmologist, son-in-law is an ophthalmologist, and son is doing MBBS. So what happens if your child are ophthalmologist or medico? You are always, now at this age of time, you start thinking that probably they will come and join me and make my life easier and will help my center grow. But does this happen all the time, or how does it going to happen, and what are your planning? So this is actually my thought and my experience. This talk is based on my experiences. This is basically Man Ki Baat. So many of this may be applicable to many of you. This can be just be replication in your own life also. So before coming to the next generation, let me introduce myself. I started my clinic in after having spent as assistant professor in RIO. Before that, did my post-graduation from Good Institute. I started my clinic in 2002, and now so over 22 years of my life in private practice. I started with very small investment, very small amount as corpus. So I tried to use that as and I invested in refurbished machine. Now certainly I am a busy practitioner if I look at myself, because I am busy all the time, and I've reached to a satisfactory level gradually, not overnight, but it took some time, and now earned a goodwill and created a brand. And now my center is equipped with one of the best available machines in the market. So currently I have a team of 6 ophthalmologists. Many of the ophthalmologists came, joined, then gained some name, experience, then left after gaining some experience and goodwill. So it's very difficult to retain in this era of multiple, because we have, the new generation have a lot of options like working in corporate, lot of medical colleges have opened, many centers, ophthalmic center have come, so they have choice of joining those centers if they are academically interested or private establishment. So I think to succeed, ideal would be somebody from family who has the feeling of ownership, so that I can take this hospital or center to next generation, and this is my clinic kind of feeling would, I think, will always be better. So my spouse is helping in hospital, so just I told that my daughter was not very much interested in ophthalmology, but gradually, sooner or later, she became interested, and now she is doing fellowship also. So I helped in motivating her to go to Opthal to do PG, and got married during internship to PGT of same city, Patna. Now he's a consultant and trained veterinary surgeon. So daughter was guided in such a way that if she comes, or if I manage to bring her to my place, she covers the other sub-specialty. Like myself, I take care of the anterior segment or refractive surgery. My son-in-law already we are veterinary surgeon. So I motivated her to take some other sub-specialty. So you can plan in this way if your generation is pursuing some course. She is doing cornea. But as you know that when the COVID came, everybody went into some kind of depression, or you can say that there was slump in everything. So I also became conservative, and at that point of time my daughter never said that I will come to Patna, because Patna, you know, is a two-tier city, and having spent at metro cities for training, these days the children, they do consider the quality of life is very important factor. So she was very much reluctant to come to Patna. So what was in my mind if none joins me? There are a lot of challenges nowadays, as discussed by a previous speaker. If you have to sorry, if you want to run your hospital, there are a lot of problems nowadays cropping up, like government legislation. Every day we hear that you have to follow these norms, and that. And not only that, the patient's profiles is changing. They are becoming more and more demanding. There is a lot of cutthroat competition in the ophthalmology also. When I started, we were only few ophthalmologists in our area. Nowadays, in those areas, only 100 ophthalmologists are there. And obviously, as the things goes, some of the amount of unethical practices now has cropped up in our subspecialty or specialty also. And this is an era of digital marketing, or a lot of people are indulged in that. So what I thought that I would work for next 5 years if they don't join me. But my alternative plan was to join some chain of hospital if none of children come to my place and they go to some other place. Like sometimes they think about going to some foreign country for further training. So I don't know what, but still the things are not so clear. But at the same time, so why the next gen they don't want to come? The things which I just told you, that in two-tier city they feel that the quality of life is not good, lot of problems are there, lot of things needs to improve in these two cities to just attract these people. They needed counseling regarding, but they don't, at the same time they don't see the struggle or problems they face if they go to some new places as newcomer. So they will have all the disadvantages of newcomer, and they don't understand the advantage of joining an already established center. So that has to be counseled, and how to make them happy to retain in our center is, or your center is, to give them a very good work environment, culture, equipment as per their requirement, good amount of remuneration or incentive, make them partner or shareholder, offer them some leisure trip every 6 months, so that these things can attract the children to come to even tier 2 city or 1 cities. If they join, there will be win-win situations for all of us. Like we can scale up the facilities what we have right now. Like we can provide treatment under one roof, all the subspecialty can be covered. We can expand further, and if in due course, if somebody plans to open some new center, that is possible. We can install higher machines. You know that all these times machines are so costly, and every day new machines are coming. So unless you have somebody to look after or to utilize that, then the money goes wasted. So you can add those machines if your children joins. Like I had in mind to install femto laser, maybe flax, or to start academics like DNB courses if they join us. So these all things are there in my mind. If suppose they finally plan to come, then the next question will be, how do you want to launch your children, it's not that the moment they come, they will start having their own patient. It's very difficult nowadays to get patient. So there should be proper launching of those your kids. So you can do this by inaugurating a new facility, organizing a get-together, workshop, meeting, and you can use these situations to launch your children so that they are visible to many persons. You can do, initially you have to promote your children so that they get the patient, because once you have established yourself as a practitioner, the patient comes for, by your name. वो खोजेंगे कि where is this senior doctor, so they will never go to the, so you have to promote them gradually and gradually. I think in-house promotion is the best way. You have to offer them, you have to suggest the patient for cross consultation, like you can say कॉर्निया के बेस्ट डॉक्टर ये हैं, यू हैव एक बार उनको दिखा लीजिए. इन दिस वे यू कैन जस्ट इंक्रीज देयर पेशेंट होल्ड, एंड दिस वे द पेशेंट विल कम अक्रॉस, दे विल कम टू नो दैट probably for this subject or this subspecialty he or she is a better person. And getting referral from peer and friends, making them visible in social media or website, organizing camps, social awareness meet, or participation in the local ophthalmic and relevant scientific meets. By these all these things, the next generation can be made more visible to the surroundings. Currently, as of now, I am not yet clear whether they are going to come or not, because after this, मुझे ये करना है वो करना है. These days, all children are very much ambitious. So I don't know, but hopefully, if I get yes from them, probably I will have team of another 2-3 from my side, and so slowly motivating my son to take up ophthalmology. And I think 50% is motivated now. So maybe that my son also joins later on. If he thinks that, if he is ready that I will do ophthalmology, then I will make him to take some fellowship where I am lacking in my hospital. So you can plan or you can guide your children in such a way that you have a team of all the subspecialty. And my future plan that even if they join, you cannot take liberty to retire immediately, because you have to pass on the baton. It takes some time. So even if they join, I have to serve or I have to work with the same capacity for nearly 5 years till the patient gets transferred to them. And the retirement should be phase-wise. You can just decrease your working hours and or maybe a day. And after a certain time, your role will be more of, or my role will be much more of a motivator, guide, or troubleshooter, or where I needed, I will fit myself. And if they join, I will have much more time to pursue my passion, or you can say I can enjoy my life, some of the life which I have devoted, most of the life I have devoted in my clinical practice. So I will have some chance to do some recreation and other things, and everybody would like to have their children to come to their place so that they can have some these times to enjoy. So thank you very much.
Thank you, Dr. Subhash. I hope in a few years you have the team of 5. I request all the speakers to come on the stage for a group photo with your caps.
With your caps.